Hello, I'm Gustavo Tolosa, the host of every month's book club, the online book club. And today is session 5, the last session of the January 2022 book club. We're reading Dr. McDougall's Medicine, a challenging second opinion by Dr. McDougall. And we are finishing with chapters 8 and 9. I don't have the book to show you here, but since this was a free book, I hope you all have it. And I'm on page 231, and it's about arthritis. This is chapter 8. And so Dr. McDougall says that arthritis is actually a general term that refers to signs and symptoms of inflammation in any joint in the body. Pain, swelling, redness, and stiffness are often present during flare-ups of disease activity in any part of the body. After years of continuous inflammation, the joints become permanently deformed and crippled. In many people, the disease that is causing the arthritis affects the entire body. Involvement of joints is only one aspect of the bigger problem. In these cases, many different tissues and organs can also be inflamed and prevented from functioning normally. So there are many different causes of inflammation of the joints. A simple type of arthritis to understand is caused by a physical injury to a joint, such as twisting your ankle, for example. Infections with bacteria or viruses can cause a sudden onset of arthritis that is relieved in time by healing or by treating the infection when appropriate with surgery and antibiotics. Gout is a type of arthritis caused, at least in part, by eating rich foods containing large amounts of substances called purines. I'm on page 232. So why are doctors so sure that diet has nothing to do with arthritis? Well, Dr. McDougall tells us that that is what doctors are taught. There is a very reputable foundation, the Arthritis Foundation, and they publish and distributed a pamphlet, I guess, that is called The Truth About Diet and Arthritis. And this is what it's declared in bold print. There is no special diet for arthritis. No specific food has anything to do with causing it, and no specific diet will cure it. Dr. McDougall says this is a very strong position statement on diet and arthritis released by a respected national health organizations. Why should anybody look any further for information on the subject? Because of this brochure and related statements, you and your doctor would reasonably assume that all needed research has been done. All the results have been analyzed, and there is no point in worrying over the possibility that what you're eating each day might affect the course of your disease. You may be surprised to learn that the statement that I read above is not actually founded on scientific research. In fact, the medical literature to support their dogma is practically non-existent. Most arthritis research dollars are spent on testing high-profit drug therapies, of course. So what else do we have here? And of course, you all know that I pick part of each chapter, because if I was going to read every chapter to you, it would take hours. So then on page 236, Dr. McDougall says that gout is easily stopped if you eat foods that are low in purines. I think that's how it's pronounced, Purines, and as well as low in proteins. Here we have protein coming back to haunt us again. We have talked about protein throughout the book. Excessive protein, and especially animal protein. There is another kind of arthritis that is called osteoarthritis. This form of arthritis can be identified in 35% of the knees of people as early as age 30. That is young. So about 35, maybe a little more percent of people that are 30 years old, as early as 30 years, they already show some osteoarthritis. And then at least 85% of persons aged 70 to 79 have diagnosable osteoarthritis, which much of the time will compromise the quality of a person's life. Osteoarthritis, Dr. McDougall says, is seen most frequently in the joints that are most used and abused. So, in later years, a carpenter may find his wrists, elbows, and shoulders becoming painful and stiff. A tailor eventually develops swollen, stiff joints in the hands and fingers deformed by unsightly nodules. So, what would we consider proper exercise? Exercise is often too severe, and injury is done to the joints, bones, and surrounding muscles and tendons. Football players, basketball players, and joggers are notable for injuries to their knees and ankles. So that is why I don't run. I've never liked it, but that's not because I don't run. But I can see how the constant pressure on the knees from running does have an adverse effect later on in the years. And I do have relatives and friends that I know that are middle-aged and do have knee problems, and they do run or play, like Dr. McDougall says, football or soccer. Tennis players can have recurrent pain in their shoulders, elbows, and wrists later in life, because remember that while you're young, the body can take all this abuse, but later in life, osteoarthritis may plague many health-conscious people who have done their best to keep fit with exercise while they were younger. Another instance of excessive wear occurs when a bone is broken and in setting it, the nearest joint is poorly aligned. Such a joint soon shows signs of osteoarthritis because of the excessive wear and tear caused by that improper alignment. And I find this extremely interesting, because we as pianists, when we learn technique and talk technique, and when we um, constantly are trying to work on proper technique, we're always talking about alignment of the elbow, of the wrist, of the shoulder, because we know that if all these joints that we use to play the piano, but I also know that it's the same with guitar, violin, whatever. If they're not aligned, sooner or later you will show signs of injuries. So I find this very interesting, actually, that it is true. So Dr. McDougall says, I suggest that you try walking, which is really what I like to do. Bicycling, I like bicycling also. Dancing, well, I don't really like dancing. Or swimming, and yes, I like swimming, but I don't swim. So my activity is walking pretty much. Find something you enjoy so you will keep on doing it. Yeah, because if you choose an exercise that you don't enjoy, chances are that sooner or later you won't continue it. And exercise only to a point where the pain is not made worse. That is, if you have osteoarthritis and you're exercising. If on the next day you are more crippled, then the amount of exercise obviously was not beneficial. All right, so then I'm moving on to another page here, and this is page 241. And the question is, how could fats and cholesterol in the diet deprive the joints of oxygen and cause rheumatoid arthritis? Well, normal circulation is a vital factor in the health of all tissues. All of our tissues need circulation because this provides oxygen, it provides nutrition, and a method of removing the waste products. The most common chronic disease in the United States is hardening of the arteries or atherosclerosis. Dr. McDougall says on page 242, joint tissues deprived of oxygen become inflamed. This is one of those things that I say highlight it, underline it. Joint tissues, when they're deprived of oxygen, and how are they deprived of oxygen? Well, if there's not good circulation, so they become inflamed. This inflammation causes the production of antigen-antibody complexes. The tissues swell and become painful. The clinical picture is that of rheumatoid arthritis. Both animal fats and vegetable fats will decrease the amount of oxygen that reaches the tissues. That's why in the starch solution that Dr. McDougall recommends, there are no animal fats. There are no meats, there are no dairy products, and there are no vegetable oils because they decrease the amount of oxygen that need to reach the tissues. So the question is, what kind of fat has been found to benefit patients in rheumatoid arthritis? An unusual kind of polyunsaturated fat is synthesized by marine algae and plankton, which serve as food for smaller fishes. And to make it easier for pronunciation purposes, it is called EPA. This is not the same kind of fat that is found in such vegetable oils as those expressed from sunflower seeds or corn kernels. High concentrations of EPA are stored in the bodies of certain marine fish, such as mackerel. So, when this type of fat or acid is fed to human patients, it has a drug-like effect in that it suppresses inflammation. It does this by decreasing the production of prostaglandin hormones and by inhibiting the activity of the white blood cells that take part in the inflammation processes. EPA then is a medication to reduce inflammation, but this medication does nothing to remove the cause of the arthritis. And of course, we always want to go to the cause. We're always going to want to go to the root and fix the problem, not the actual effect. Okay, so it will reduce inflammation, but it won't remove the cause of the arthritis. Dr. McDougall says 18 capsules daily in divided doses have been administered with some success. 18. Taking concentrated fish oil as a therapy for arthritis has some drawbacks, however. 18 capsules of fish oil represents an extra 162 calories per day, which maybe doesn't sound like a lot, but think about 10 days. You have 1,620 calories. Think about a month, multiply that by 3, or 4, which can add to a problem of obesity. There is evidence that oil of any type, but especially the EPA varieties, may increase the risk of gallbladder disease and certain types of cancer. Inflammation has also been suppressed in experimental animals by restricting calorie intake, eating a low-fat diet, and losing weight, each independently. Although these three circumstances are often present together in a starch-based meal plan. Basically, if you do these things, you will be taking less calories, you will be in a low-fat diet, you will lose weight, etc. Thus, several more possibilities can be explored as treatments for people with rheumatoid arthritis and similar conditions. On page, let's see here, 248, it says that the important fact that we need to remember is that foods have profound effects on health and should be the first things that anyone with arthritis should investigate. The treatment I recommend, Dr. McDougall says, not me, is without any adverse effects and will cut your food bill considerably. Furthermore, the proper foods will benefit the arthritic patient with an improvement in general health and a helpful loss in weight for those who are overweight. Fortunately, the diet that is most likely to help in preventing and treating arthritis is also the most effective and safest way to lose extra burdensome pounds. Weight loss in the obese arthritic patient is reason enough for a change in diet. So that concludes chapter 8, and I hope that you will consider all these facts. Go back and read chapter 8. If you don't have the electronic version of the book, you can email me and I will send it to you because it's not free anymore on Dr. McDougall's website. And that you will think about this issue, that our bodies are sustained because we provide it with nutrients and calories, and those can only pretty much unless you have an IV or something, I don't know, or another method of feeding, come through our mouths, through what we eat. And so it makes total sense to me that what we eat does have an impact on the cells and the tissues of the body, because that's what they get. They get whatever we give them. And I hope that you will consider this, and that at least you will give it a try. Like Dr. McDougall says, if you eat healthy with a whole food, plant-based way of eating based on starches, so that you won't be starving, your whole general health will improve. Give it a try of 2 weeks. It's not much. 3 weeks, they say that 21 days is always a very good number when trying to establish new patterns. Just try 21 days. If not, at least give it a try of 10 days. Be strict. Don't start going off the plan the second day. Be strict so that you can see the effects. If you don't see any effects in 10 days or 2 weeks, well, okay, keep doing what you were doing, but chances are that you will see a major positive difference. Have a wonderful day or week, and make sure that you look in the YouTube channel for the next video, which is chapter 9. And chapter 9 is on urinary disease, another very common health problem that both men and women have to deal with. And in the description area of this video, you will find the link to the urinary disease chapter 9. Make sure you subscribe to this channel. It helps me to continue making videos, free videos, and click on the little bell so you get notifications. And thank you for watching. Bye-bye.